Hi everyone, it's Ashley with Ashley Culbertson Fitness, and I want to thank you guys again for participating in my 5-day Running for Success group. We are on day 3, and earlier I asked you guys the question, where does your foot contact the ground when running? Meaning, do you contact more on the heel, the midfoot, or your forefoot, more balls of your feet? And overall, a lot of the research from the course that I took encourages runners that especially have injuries, pain running, to look at transitioning to more of a midfoot to forefoot position when you contact the ground. The reason behind that and the reason behind avoiding being a heel striker is if you think of your foot and say the more of the palm right around your wrist here, if that was more your heel, when you contact the ground with that more heel, that sends a lot of extra added stress up through the ankle, the lower leg, through the knee, the upper leg, up to the hip and spine. A lot of times what you'll find are people that overstride, meaning they take longer strides when they're running, longer steps, tend to then contact more with the heel. I won't say always, because I have actually videotaped and video analyzed runners that overstrided but yet still contacted a little bit more mid to forefoot, which causes different types of stress and therefore different types of injuries. We won't get into that because it's not as common. But one thing, if you guys are in an area and have a physical therapy clinic that does running analysis and you're interested in knowing, that would be something to look up, to have somebody videotape for you while you're on the treadmill. A few cues that you might be able to tell if you're a heel striker is when you're running, whether you're outside on the treadmill, are you very loud? Is it real kind of, or do you run more quietly? Those, if you guys have ever been on the treadmill and you're running next to somebody, it's just thump, 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 thump. Those people are most likely contacting more with the heel, because again, your heel, that bone, it's going to make a louder noise than more in the balls of your feet. So that might be one way you guys can tell if you have a hard time physically feeling. Some people can take a look at their shoes to see where it's a little bit more worn. That's not always a true indication either. But when it comes to running analysis and taking a look at someone's gait, I, in my running clinic, do that for patients, so people that actually have an injury, whether it's from running or another type of injury and they want to get back to running. But I also do analyses where they might just be a collegiate level, recreational level runner, and they just want to know what they look like. And those people that don't necessarily have pain or an injury when running, even though I analyze their running mechanics and go through things, I don't necessarily change things if they're more contacting with their heel. Again, when someone doesn't have pain, as a therapist, I have to look at that patient, that client as an individual, and what are their goals. If they came in and just wanted to know, I will of course educate them now down the line, even though you don't have any pain, shin splints, or you haven't ever experienced a stress fracture or knee pain, you might be setting yourself up to something in the future. But in the end, if a client does not have pain, I do not necessarily go ahead and try to change their mechanics. Now, of course, if you're a patient, if you're a runner that has pain, you've got to think of something. You've got to do something different, because even though your symptoms alleviate and you get back to running for a period of time, if you don't fix the underlying issue, the underlying cause of extra stress to your body, your lower legs, if you don't address strength or flexibility issues, then things are going to keep coming up. So think to yourself, I mean, how many times have you guys gotten shin splints? Do you feel like you heal, you get back to running, and then a month later, 2 months later, things come right back, and you don't know what you're doing or how to fix it because you feel like you're doing the exercises, you feel like you're doing the stretches, but you're still having issues? Then maybe it's time to look into a physical therapy clinic locally that actually does that gait analysis, running mechanics, where they can offer some suggestions. I've had a patient where she came in with low back pain and symptoms down her leg, and we got rid of the symptoms down her leg, and her back pain significantly decreased. The only time she would then get it was when we started getting her back to running. And so we videotaped her, and she overstrided, and she contacted more with her heel. I went through one simple technique, gave her an instruction of how to work on it at home, came back a week later pain-free, and she was back on track to her half marathon, and we did not have to cut her out, cut down on mileage. We didn't have to bring her back into therapy and say, oh, you need to keep doing these hip and core exercises. I've seen people that have come in for an evaluation, and boom, day one I videotape them and make one simple suggestion of shortening their stride. They come back and see me a week later, a couple days later, and their symptoms are 50% better. And I have not even put my hands on them for treatment. I have not necessarily even given them strengthening or flexibility type stuff yet. So there's a lot of benefit to having that done. But again, you got to kind of weigh things, and whether you're a person that has injuries or a person that does not. Because if you don't, you could potentially cause injuries and symptoms, pain, by trying to switch things over. So again, when you're running, you do want to transition to a midfoot, forefoot, potentially if you're not in that contact area and you have symptoms. One way that I teach patients to do, and again, this is a disclaimer because even though I'm sharing it with you, I don't know if you guys will necessarily benefit from it, but it's something that you can definitely try. And I call it step rate manipulation. And research has shown that if you are an overstrider, increasing the number of steps, the number of times your foot contacts the ground by even 5% can significantly help. So what I would have you guys do is try that out, and the next time you're on a treadmill, warm up a little bit. You want to get to what you would consider your race pace, and kind of run there for 5-6 minutes, and then start counting, because research shows it takes about 6 minutes for a person to kind of get into their groove, their running mechanics. And that's why, of course, we don't just start off running and feel like we're right where we need to be and at our pace and real comfortable. It takes us just a little while to get warmed up here. So get on the treadmill, warm up at your race pace for about 5-6 minutes, and then just one foot, count how many times you hit the ground. Some people do for 15 seconds. I usually have my clients and I count for a minute, and then I double that. But I take that initial number, say you count one foot 84. I would start with somebody, I would add 5%, which would be about 4 steps. So then I would have them practice it again, trying to hit 88. I have my clients use a metronome. There's a lot of different metronome apps out there. Depending on your phone, you can just Google running metronomes, and you can actually set it then for 88, and then you start the treadmill, start running, and then you'll just naturally hear and kind of pace your foot at that same step. And by increasing numbers, you're going to shorten your step, which is going to get you off of that heel a little bit more. Again, I have clients that I consider a rear foot, meaning they still hit more in the back, but heel strike is that real end point back part of your heel that really contacts. So your toes are really high up, and that's what contributes a lot of times to shin splints, is because the front leg muscles, you're bringing your toes up so much and hitting and striking and then having to roll your foot down and push off. So the front leg muscles get overworked, and that's what shin splints are. And the longer you go like that, you set yourself up for then stress fractures. So those are my tips. Please post questions, comments below, and I can go in a little bit more detail. Again, disclaimer, I can't treat everybody through internet like that. I would definitely be more than happy to try to help set you guys up with somebody in your local area. And I can try to talk through anything further. But again, if you do have symptoms and you haven't been treated by a therapist, I highly recommend looking into it, because we as a physical therapy profession can get runners back to running safely. And sometimes we can even do it without even having you completely stop your running, which is even better, especially for high school, college athletes that I work with. Coaches, athletes do not want to hear they have to stop running. You guys don't want to have to stop running. I know, because I'm that crazy person too. I go crazy being inactive, but let a professional help guide you guys. So remember, mid forefoot is something you want to think about if you have injuries. If not, you might not want to mess around with it. But try out the step rate manipulation. I taught it myself even before I was a physical therapist practicing in a running clinic. Another quick side note, when you do transition like that, you can't just go out and run if you're on mile 5, 6 for your training, you can't just all of a sudden run. You have to kind of back down and progress when you're starting to transition, because different muscles are starting to be used. So that's something else to think about. Again, thank you guys so much. I am very grateful and blessed that you guys have watched this and followed me in the group. Comments, questions below, and I will see you guys tomorrow.